Hi, my name is Charlotte Farewell, and I'm the Concentration Director of the Population Mental Health and Wellbeing Program, an assistant professor with the Community Behavioral Health Department at the Rocky Mountain Prevention Research Center and the Colorado School of Public Health. And today I'm going to be talking with you just very briefly about some of our work related to mental health and early intervention. So much of our work is framed around two theories. And the first is the developmental origins of health and disease, which really stipulates that early life development, particularly in utero and the first few years of life, are critical for laying the foundations for later life outcomes. And we know that what happens during these early critical periods impact child health via physiological mechanisms and behavioral pathways. And then building off of DOHAD, we look at the life course health development theory, which again posits that it's this combination of risk and protective factors early in life, so in the first 5 years of life, that impact health trajectories. So you can see some examples of known risk factors here, such as poverty and social determinants, and then protective factors in green, such as caregiver well-being, both parent well-being and early childhood education caregivers, so anyone that's providing support for a child in the first few years of life. Structural services like health services and high quality preschool can impact healthy trajectories. And we specifically focus much of our work on really promoting caregiver well-being via community engaged programming. So one of the first projects that I'm going to briefly mention is a project focused on promoting the well-being of pregnant women. And this project is called the Mindful Moms to Be program. And we partner with the UC Health Integrative Medicine Center on campus to implement and evaluate this program that uses mind-body techniques to mitigate depression, anxiety, and stress across the perinatal period. And this is just a table you can see of our data thus far. Specifically because of COVID-19, we adapted this program for remote delivery and explored using both quantitative methods, so a pre-post survey, and in-depth interviews to understand the kind of feasibility and practicality of remote participation in prenatal programming. And we saw, for example, that remote delivery was highly practical and eliminated a lot of barriers that folks typically experience in attending perinatal well-being promotion programs. The second project I'll briefly mention is some of my work that I do in New Zealand with the Growing Up in New Zealand study. And this project is called the FRAME study. And the goal is to really investigate depression trajectories and how depression from the prenatal period through postpartum impacts child growth and development outcomes, and then protective factors that may promote well-being and mitigate depression. And so briefly in this table, you can see that we looked at some of these social determinants that we know are associated with depression risk, but then informal support and community belonging specifically were protective factors that were associated with positive well-being and reducing depression during the perinatal periods. Our third project I'm going to mention focuses, now moving out a bit more into the life course, on early child education caregivers, both former caregivers providing care for kiddos age 0 to 5 in center-based settings, and then family, friend, and neighbor caregivers, which are often grandmas or neighbors who support, provide care for children other than their own. And I'm implementing this intervention with Dr. Jenny Puma. It's based in community-based participatory research, and we implement this work in 14 counties throughout the state. And it's a multi-level approach to promoting well-being among these caregivers. You can see an example here of one of our social networking events on the right, where caregivers participate in different self-care activities, in this case, yoga. And here's an example of one of our flyers and some of our preliminary impacts. Again, we're collecting qualitative data and quantitative data to assess the efficacy of this project. And then finally, one of our newest programs is called Well, and it builds off the previous project I just presented to do a more in-depth analysis of different policies and practices that are associated with well-being. You can see here on the right. And we are going to explore how well-being of ECE caregivers impacts burnout and turnover, which are very, very high in this population, and how that in turn impacts the quality of caregiver-child relationships and child outcomes. And then we'll use those data to implement this program. You can see on the left, this multi-level program that will be structured to promote well-being in rural and urban counties, Head Start populations throughout the state. And finally, we have a lot of student RAs that get involved in our projects. And so you can see some examples here. For example, for free, we have a couple folks right now, one doing a study collecting data via interviews to understand cultural perceptions of mindfulness around Latinx caregivers in the Spanish-speaking community. And we have another that has investigated the impacts of COVID-19, specifically on formal and informal caregiver mental health and well-being. So if you'd like to learn more about the Population Mental Health and Wellbeing Program, please reach out. I am available to meet and looking forward to connecting. Take care.